in future health projections, it's interesting because this is where our current healthcare paradigm, or as I call it, the sick care paradigm, because that's when you enter the healthcare system is when you're sick. They've missed the mark on this one. Future health projections means let's take a real hard look at where your health is headed right now, given the way that you're taking care of yourself or your body. And what our current healthcare system, sick care system says is, who cares about where you're headed? Let's just make it so you feel good today. Who cares about tomorrow? Just take a pill or get rid of the symptoms and we'll assume that everything must be fine. So it's a paradigm shift for our patient in this section where we need to really step back and say, okay, now I've shown you your subluxations, you've seen what a subluxation does, you've seen how it's affecting you personally, now let's look at where this thing is going. And are you okay with that? And it's important to say it almost just like that. Are you okay with where this is going? Because let's project forward 5 years, 10 years, and let's assume that you continue to do the same things that you've done to take care of yourself before, and you continue to do those same things. What will happen to your condition? Will it continue to progress and get worse, or will it change and improve all on its own? And the obvious answer is, of course, it'll progress and get worse. So it's important in future health projections that you really connect with the patient and ask them to take a real hard look at where their health is headed, given the status quo, and ask them, are you okay with this? Because if I was in your shoes, I would not be okay with this. I would want to make sure that I made a change in my health and changed the course of my future right now, given what I just learned. That's the basis of future health projections. And I'll give you the scripts to use for that in the seminar. We have future health projection scripts, and I'll show you exactly how to do that. So get that from the website, download it, use it, learn it, but really use this opportunity to connect with your patient and say, almost just like I said, if I was in your shoes, I wouldn't be okay with the way it's going, but the good news is you're in the right place. I know how to change the course and direction you've been headed, and we're going to take it in a new direction, which is going to be incredibly more positive, fun, and maintain the quality of your life for the long term. Are you on board with that? Of course I am. Let's do it. Let's go. And that's how you dial in the future health projections.